Yes.
Hello everyone. Welcome to all the participants. Today we have very special speaker, Dr. Vandana Baranwal, Senior Ayurveda Consultant from Ayurveda 3 USA. She is leading Ayurveda practitioner specialized in women health. She is educator, practitioner and speaker of international fame. She has 25 years of rich experience in the field of Ayurveda. She is author of book named Stree Rog Vimarsh. She has been awarded with Charak Award for her excellence work in the field of Ayurveda. Before moving to USA, she was professor in Prasuti Tantra and Stree Rog in Rajiv Gandhi University, Bangalore. Thank you, ma'am, for being with us. Over to Dr. Vandana. Thank you, ma'am, and welcome for today's session.
Thank you, Dr. Pooja. Thank you very much. I'm very happy that you have invited me as a speaker to this prestigious platform, NirogStreet. And I welcome all my Ayurveda practitioner colleagues, teachers, students. And today I am going to talk about pregnancy care with Ayurveda during COVID-19. So, as we all know that this pandemic has been here since the beginning of this year, January. In fact, it has been here before this year started from 2019 and January 2020. WHO has declared it to be a public health emergency of international concern. More than 180 countries have reported confirmed cases. And it is just one continent, Antarctica, where there are no cases of COVID has been found. In India, more than 3.3 million confirmed cases are there. As till August 27, and today it is 7th of the September, numbers have increased, and it is increasing. And around 2.6 million patients have recovered. That is an awesome number. We have fatalities, and that counts as 61,000. Fatal cases are there, and fatal cases are mostly associated with when there are comorbidities like hypertension, diabetes, and other like cardiac diseases, or in people aged over 60 years. So this is the general scene of COVID-19 currently in India and all over the world. Sitting here, we as Ayurvedic Stree Rog Prasuti Tantra Visheshagya, I would like to see what the scene is for pregnant ladies. The people are suffering. Are women who are pregnant at increased risk? When they suffer, do they transmit that to their kid, to their child that they are carrying? So when you are practicing in your OPD, you get pregnant ladies or their family members, concerned family members, and they ask you questions. They want to know that what special precautions we can take to keep the pregnant women safe. And pregnant women want to know if they are at increased risk, what they can do if they have fever or cough, or what they can do if they come in a contact of a person, in the contact of the person who has tested positive. And they also want to know if they test positive, are they going to be very ill? Is it going to be fatal? If their baby is going to suffer? If any test can detect the baby is going to be affected adversely or not? And they also want to know if the routine checkups, they come for routine checkup, is it safe? How frequently they should come? And after the delivery, if they can breastfeed their baby. There are many questions they ask, and there are many questions that would be in your mind as well. So today's talk would be focused on these general things that we want to know commonly, ask questions. So there, we just do not sit in darkness and think and devise our own means. Here we have guidelines from Federation of Gynecology and Obstetric India, and from international as well. International FIGO guidelines are that they are divided into 4 categories to address every sector of pregnancy, journey of pregnancy, like when the patient is ambulatory, they are well working, and they can take care of themselves. and they want to visit as an outpatient clinic. We know that pregnancy is not a disease, it's a physiological change. So such women, when they want to have routine checkup, there are guidelines for them. Then there is obstetrical trials where we decide who is at risk, who needs immediate attention, who can wait. And then there are guidelines for intrapartum management at the time of labor. And there are guidelines for the postpartum management. Today, I am going to focus my talk on ambulatory antenatal care in outpatient clinics. So what happens that we are going to follow here, there are international guidelines, but we are going to follow here. Every country has adapted it to according to their own, and we are going to follow here that is given by International Federation of Gynecology and Obstetrics India and the ICMR, Indian Council of Medical Research. These are the general guidelines that every doctor, whether they belong to Ayurvedic fraternity or homeopathy or they are biomedicine MBBS doctors, every person who is having pregnant lady as their patient should follow. So what the guidelines they have is that when the patient calls you for the appointment, suppose some lady has tested positive and they call you, what to do? You have to explain everything to them over the phone. Prior to the visit, at the time of appointment is scheduled, you need to explain everything to them. And there are two things for the COVID testing and COVID screening. COVID screening have a checklist of questions, tools that can be asked over the telephone itself. So that is called screening, when we ask questions to see if the patient falls or the person who has called falls in the range where we need to test. So just over the phone check whether they are suffering from fever, if they have shortness of breath, if they have dry cough, if they have pain in chest, or if they are spitting blood and it is more than 1 teaspoon. So these are the checklist questions need to be asked over the phone. And then there is once the appointment is scheduled, you need to explain to them that how they have to come, taking all the precautionary measures, put on the mask, carry the hand sanitizer with them, come with only one attendant, come at the appointment time so that they do not have to wait for longer time. And then there would be screening at the door as well. Screening at the door, that is at the entrance of the hospital or at entrance of your OPD. Fever is checked. If they have fever, they are into the different category. They should be checked. If they do not have fever, then they are like the patient who have fever and patient who do not have fever. There are two categories. Let's continue with the patients who do not have fever. Then they are taken inside and the routine checkup is done. If they have fever, then they have to be managed like if what other symptoms are there. They could be asymptomatic and infected with COVID. So you have to take whether they have been exposed, if in their household, if someone has tested positive. If there is no fever, let's continue from there, that if they are not into labor, they do not have fever, so they come into the category of routine checkup. So how many checkups they should have is that they should be checked at 12 weeks, 20 weeks, 28 weeks, 32 weeks, 36 weeks, and 37 to 41 weeks once. They are advised at the appointment time itself that these are the times they have to come. Once they are in your OPD, then also you schedule their next visit when they have to come according to these guidelines, that they need to come at 12 weeks, 20 weeks, 28 weeks, 32 weeks, 36 weeks, and then finally at 37, 41 weeks. If there are any symptoms, they have to call. It could be telephonic call or telemedicine. They have to call and inform that they have these symptoms, they have these problems. They do not have to visit the hospital without, or the OPD without the appointment. In India, it is very common to miss appointments. They just take it for granted that they are not suffering from anything. The first visit went normal, so they simply sit at home. So it is doctor's responsibility, according to the FIGO guidelines, it is the doctor's responsibility that if they have missed their due visit, they have not called, they have not contacted the doctor, then at 3 weeks, after 3 weeks overdue, Doctor's responsibility is to call and check with them over telephone, or if they do not respond, and it is doctor's responsibility to go visit them in the full personal protective equipment. They can also have the visit by ASHA worker or ANM. Then here the role of telemedicine is very important during this pandemic. FIGO guidelines emphasizes on that once it is the time for their visit, only then they should come. Rest of the consultation should always be done over the phone. It should be stressed upon by the doctor that it is safe to stay home, but it is very much required to come have the visit when it is due. And then what happens is that pregnant patients who are screened and they are having positive, then what to do? If they have tested, if they just have fever, we want to know that universal testing is required or not. So if the patient have fever, it is not necessary, it is not mandatory to go for COVID testing. There is no universal testing for a person just suffering for fever. We can wait for a week or 2 weeks to see if fever subsides or not, if other symptoms develop or not. If the person is coming from the hotspot area, then the immediate COVID-19 testing is required. During pregnancy, if they are more susceptible, they have higher chances of having the COVID-19, then that question can be answered that during pregnancy, there are physiological anatomical changes inside the body, which are the part of the change because they are pregnant. So that compromises their situation a little, but it does not increases their chances to infection. It is just that if they get that infection, the clinical course may be different, the severity of the symptoms could be there. So there are no evidence, although at this point I want to emphasize that the cohort of studies are small. There is no evidence to say that pregnant women are more susceptible, they suffer more, or anything like that. There are no research to support these things. So we can just say that because of these physiological changes and anatomical changes, the susceptibility is more. If they get infection, the severity of the symptoms could be more, but it does not mean that they should be scared that they are going to, just because they are pregnant, they are going to get infected more than the other people. One of the changes is that during pregnancy there is hemodilution, and other is that during pregnancy the hypercoagulability is increased, and COVID-19 is also hypercoagulable state. So the chances of the pregnant ladies suffering from venous thromboembolism are more. That we can keep in mind, but there are no evidence or no research studies to suggest that there is vertical transmission or teratogenicities or early pregnancy loss. So they should not fear. And at this point also, I want to add that from the FIGO, there is no guideline for early termination of pregnancy just because the pregnant lady has tested positive. Vertical transmission, like you all know, that they're getting transmitted from mother to child, whether it is passed through placenta or passed while breastfeeding. There are no research to support that. Some of the cases, it is on very small cohort that preterm birth has been noticed. But like I already said, it is not an indication. COVID-19 is not an indication for MTP. What if the patient has tested positive, confirmed positive COVID-19 patient, pregnant women, if they are patient of COVID-19, then anomaly scan is suggested at 18 and 23 weeks of gestation. And it also says that once they test negative, since they tested positive, and after they visited their doctor, they took the medication, and again they test positive. After that, also 4 to 6 weeks, the routine scan of the USG should be done. And in amniotic fluid, it has not been confirmed. And the patient who test positive, before coming to the hospital. They should be managed separately from their routine care patients, and if they test negative, even then they should be screened separately from the routine care patients. So we see here that the patient who have tested positive and the patient who have tested negative, they should be segregated at every point of their visit. And my main focus of the talk was pregnancy care Ayurveda. So how Ayurveda can add value to already pregnant women during the COVID-19. Everybody is talking, since we know that there is no confirmed treatment, there is no confirmed vaccine that offers definite cure or treatment, that offers definite prophylaxis from this problem. So what we can do, and everybody is talking about, is that how we can protect ourselves. And the main thing here comes is to work upon their immunity, how to boost immunity, how to stay strong. So although pregnancy is a compromised state, but the OJS, the one factor of Ayurveda that we can work upon building is in pregnant ladies. And how we can do is that we know that how the OJS is formed in our body. Like we all know that Ras, Rakta, Mans, Med, Asti, Maja, Shukra, and the end is of the Shukra. The essence we get, not the end, the essence that we get is OJS. So from where we start from Ras. And from where we are getting this Ahar Rasa, from our food. So emphasis on the food cannot be it cannot be emphasized more how important the food is. And what else we can work upon is good sleep, quality of mental health, and taking care of deficiencies like anemia, taking care of minor ailments, and we can add some herbs so that pregnancy care can be taken safely and healthily. We can proceed on that journey with our patients. So first thing I said that working on the OJS, home cooked, freshly cooked, healthy, nourishing food is best. India is a very large country. The food preferences according to the state vary. So it is not that they have to eat this or they can eat who they are. If their staple meal is rice and dal, they can eat that. If they eat roti and sabzi, they can eat that. There is nothing special food. It should be healthy. It should be nourishing. It should be free of preservatives, chemicals, and artificial flavoring. Anything that they cook themselves and serve themselves freshly, that is the best food. That is the easily digestible food. They should eat enough quantity. They do not have to eat more. They just eat light, easily digestible, nourishing food. And we know that in Ayurveda, it is emphasized that during early pregnancy, cold, sweet liquid diet is best. So what they can do is milk, some fruit juice, lemon juice. These can be once in the early pregnancy, when they are not very hungry or they have some difficulty eating, they can drink and have enough nourishment and maintain their health as well. And the second very important thing with the normal everyday home cooked food is ghee. Ghee is rasayan, vrishya, and increases OJS. So during this pandemic, one grit that comes on the fore is Dadimadi grit. It can be taken throughout the pregnancy. It has pipli, shunti, dhanyak, and chitrak. Though we know that chitrak is like Agni, Pradhan Agnik, and pipli also in large amount is not good, but along with all the herbs, given in the used judiciously in adequate doses, it can be given. And from 6 to 8 months of pregnancy, Ayurveda also emphasizes on the use of Gokshiru. So Gokshiru grit can be also considered. So first thing we can do working upon to boost the immunity is focus on the food. It is not very important to give every woman the Ayush Kadha or the other things, because continuous use of Ayush Kadha causes gastritis. They already have, like, gastric emptying time is decreased during pregnancy, so they may start having problems. So given in the form of grit in adequate doses, it may give the same kind of immunity building as is achieved with the Ayush Kadha. I am not saying that Ayush Kadha should not be prescribed. You are the best judge for the person, a pregnant lady who visits you. You see, I'm just bringing on the focus that there are other things. Once they show some gastritis or other symptoms where they cannot take Ayush Kada or other immunity booster things, we can consider about a form of OJS building addition, that is in the form of Grita. And then second very important thing for the mode of life, boosting immunity is mode of life. Mode of life cannot be emphasized upon more. Having a daily routine, having a schedule is grounding, nourishing, detoxifying. For pregnancy, it is just a blessing. During pregnancy, we know that sometimes they do not get good sleep and they want to sleep till late. But considering those flexibilities, some irregularities can be done, but daily bath, having food on time, maintaining personal hygiene, that cannot be compromised. So the pregnant women should take daily bath, clean the private parts and especially the breast. At the time they would notice if there is any depressed nipple, they can work upon that, they can talk to their doctor. So daily bath is very necessary. Maintaining personal hygiene is very necessary. And then sleep and adequate rest, mental peace. Sleep in itself is very rejuvenating, immunity building. If sleep is not good, nothing is going to work. There would be anxiety, there would be vata vitiation. So for a pregnant lady, it is very good to get good sleep. Just check with your patient that they are getting good sleep. And the mental health, staying at home during the quarantine, everybody is staying home. For everybody, the anxiety level has increased. The kind of situation has created a kind of havoc on their mental peace. So it is very important that they should be in the loving company of family and friends. And you can also advise them to sit and do meditation. You can give them a mantra to focus upon for chanting, or something to visualize and view and keep their mind at peace while doing this meditation. And they should definitely avoid overexertion, grief, anger, late nights, sitting in abnormal postures, and doing too much of social media, which are very bad for their immunity. And one thing that we can give as an immunity builder for the pregnant women is a combination of our Ayurvedic herbs, which are Shatavari, Amalki, and Ashwagandha. Each Shatavari and Amalki can be taken in 2 grams each. Ashwagandha 1 gram. They can be mixed together and made into three doses. It is 1 day dose. 2 grams of Shatavari and Amalki, 1 gram of Ashwagandha, mixed and into 3 doses. It can be given divided into 3 doses in a day. It can be given mixed with honey. And then Gokshuru powder can also be given with the honey. I have said that Gokshuradi Grit can also be given. And from 6 to 8 months, Shukti Bhasma can be given. Jatamansi powder 1 gram from 7 to 9 months. Jatamansi powder can be given twice a day, or you can divide. You can set the dose for your particular client. And then I have just taken some home remedies, like currently when patient is staying at home, they may not be having the facility to go to the shop, or Ayurvedic medicine shop may not be open, or if they are ordering online, it may take some time to order and get the medicine delivered. So in the meantime, what they can do at home, I have just brought some nuggets from the Ayurvedic wisdom. Dirgha Ela, that is black cardamom. Just take the seeds, stir fry it in a hot tawa, and make a powder. It can be taken 2 or 3 pinch or quarter teaspoon. It can be taken 3-4 times in the day with honey. Or the dhania churn, coriander seed powder. Simply, it is in every household. Mixed with sugar, 1 gram of sugar. It can be taken once in the morning and once in the evening. And amla murabba is one of the very best thing for nausea and vomiting. And then amalki fruit and draksha, taken each 10 gram and made into a paste, cooked with 80 ml of water with 20 gram of sugar, or even if not cooked, just like a sharbat, uncooked, mixed together. 10 gram each of amalki fruit and draksha, 20 gram of sugar, made a fine drink with 80 ml of water. It can be filtered if the patient is feeling too much of nausea and she does not like the pulpy taste. It can be given as filtered or cooked as syrup 3-4 times in the day. And then take a lemon, cut it into the half, sprinkle some black pepper, cumin, and salt on top of that, and just cook it from the backside on the flame, and just squeeze it little, and it can be licked. And then draksha, 10-15 draksha, again on a hot skillet, on a hot tawa. It can be stir fried, and just sprinkle salt, and she can keep in mouth like toffee, chew it and eat it also. If she have aversion to food and she is not having appetite, so this we call CCF tea also. It can be given in the form of tea, or it can be given in the form of powder. CCF tea is cumin, coriander, fennel, each taken 5 grams, and cooked with water, filtered. Sugar can be added to it if they want, for the taste, and it can be drink 2-3 times in a day, in a half cup amount. Or Shatpushpa, Dhanya, and Jeera, 5 grams each, CCF, coriander, cumin, fennel, 5 grams each can be taken together, made into a powder. To this, 4-5 black peppercorn kali mirch is added, and this whole powder is a fine powder, is made in the stored into a airtight box. And when they do not like food, they do not like have the appetite to eat, it can be taken 2 teaspoonful of powder with 4 teaspoon of sugar, boiled with 200 ml of water, cooled and filtered like a tea. It can be sipped. Or this powder, 1/4 teaspoon of this powder mixed with honey, it can be licked 2-3 times in the day. Again, if they have aversion to food and loss of appetite, just a small piece of ginger dipped into lemons and salt, lemon juice and salt. It can be kept into the mouth and sucked upon like a toffee. Or just grated ginger, a pinch of salt is added to it, and dash of lemon, and it can be eaten with the first bite of what they are eating. And then cloves, the cloves, just make the powder of the cloves and black pepper, mixed powder, equal amount of both are taken, mix it with 4 teaspoon of sugar and half lemon juice of the half lemon, and it can be mixed together into a paste, and little can be licked 3-4 times in the day. It also increases the appetite. Then this is a big problem, and every household may not have everything, so I have given here, shared here many options. Pomegranate juice, ginger, mint, and lemon, they can be taken together, and with 4 times sugar, it can be cooked into a syrup, and just 1 teaspoonful 2-3 times a day, or it can be added into the half cup of water and sipped upon. Powder of cumin and sukshmela and black pepper powder, bhuna jeera, choti ilaichi, and kali mirch powder in the dose of 2 to 4 grams per day. It can be eaten and taken upon. So you see, these all are the things that are given for immunity building as well. I have focused on jeera, shunti, and black pepper powder. So one of the drawbacks of the this Ayush Kadha is that it adds jaggery, which have Ushnavirya. It adds cinnamon. Prolonged use, it may cause vata vitiation. So when women are taking Ayush Kadha, many of the times they complain that they are not finding it palatable. So these Ayurvedic home remedies may prove very helpful. And like I said, food is the best immunity builder. It can take care. They definitely need to focus upon the small ailments, which are the everyday thing during pregnancy. And considering pandemic situation and the anxiety, it may these symptoms may precipitate more. So I have focused on these minor ailments. So once they are suffering from constipation or gaseous distension, so powdered ajwain 5 gram, half gram, black salt half gram, mixed together and given with lukewarm water. Or they can just take 10, 12, or they can also take 15, 20 if the constipation is more and continues for many days, in half glass or 1 glass of milk. Boil it nicely. If they want, they can eat it, or if they do not want to eat it, just boil it so that it loses its shapes, and filter that milk, and they can drink that milk. You can also prescribe Hingvashtak churn with lukewarm water. Lasunati vati can also be given with lukewarm water. Of course, you have to check to whom you are giving, and you have to set the dose and what month of pregnancy it is. Madhu ST powder is also a rasayan and very good for constipation. It is safe during pregnancy. So 3 gram of lukewarm water can be, 3 gram of Madhu ST can be given with the lukewarm water. Triflachone, we all know, is safe and it can be used for pregnancy constipation. Suppose someone is suffering from diarrhea and at home and they need immediate help. So here, continue advising them to take enough liquid diet, keep them dehydrated. If it is severe, they definitely need to visit the nearest hospital or health center. And staying at home, you can advise them dhania seeds like dhanyak seeds, shatapushpa and sugandhbala and bilva powder if they have it at home. Sometimes many households have this belka murabba, bilva sweet preserve, that is very effective. They can have that. Otherwise, this dhanyak seeds, shatapushpa, sugandhbala, bilva powder can be taken together, mixed in equal amount, and it can be having 1/4 teaspoon 2 or 3 times with honey, or its decoction prepared with the water. They can have buttermilk, which is very good. Every household have curd, yogurt, so they can prepare buttermilk and add enough amount of cumin powder. Like they can add 1 teaspoon of cumin powder, salt, and drink it. And the one I didn't say is that this shatapushpa, every household have this sauce. They can take say 10 gram of plain fennel seeds, and they just stir fry 1/2 gram of fennel seeds, 10 gram of fennel seeds, make powder and mix together. This can be taken with honey, plain with the cold water, and this is very effective for diarrhea. And then coming to the mental health for women, creating an environment at home that is friendly, that is not creating any kind of stress on women, is very important. So staying with them constantly, creating this environment, and then focusing on their healthy food, seeing that when they have these minor ailments, they have access to these small things that can take care, having access to doctor. These are the things that give mental confidence and comfort. Thus, I have someone to talk to. When I have a problem, I have a doctor whom I can talk to. Yes, I have these home remedies which I can take care of myself too, and which I can prepare in advance, and when it is needed, I can take to. So they are very helpful. Everyday meditation and chanting is very helpful. Having everyday bath, change of the clothes, and going for a walk is very helpful. And if there is hostile situation and domestic violence, give your be kind and be caring, and share telephone numbers where they can reach and seek safety from these kind of injurious environment, which is very important for their mental health. And be available for psychological counseling as well as telemedicine. And then last but not the least, it is very much emphasized that their hospital visit is important. Telemedicine have its own importance, but they should not avoid visiting to the hospital, like I said, at the designated time when their visit is scheduled. And because the regular visit is very important compared to being exposed to COVID-19, because that is the time when they are screened whether their pregnancy is progressing normally, at what time intervention is needed, at what time they have to come to the hospital, if they have any situation which is also considered comorbidity situation for the COVID-19, like hypertension, like diabetes, pregnancy-induced hypertension or diabetes, or any heart condition. So hospital visits are important, and what time they have to come, you have to emphasize upon that. I want to take this chance while I'm talking to you to bring to your knowledge that I am Dr. Pooja already told you that I am a practitioner of Ayurveda, an educator of Ayurveda in America. I live in Dublin, and which is in Ohio. And here we have this Council for Ayurveda Research. We have made this council, and our council is doing its first summit titled COVID-19 Lessons and Emerging Strategies in Ayurveda. We are doing it at the same time for USA and in India, and we have our counterpart in India as well, which goes by the name of Ayurveda Anveshan Anusandhan Foundation, which is a non-profit organization. So this COVID-19 Lessons and Emerging Strategies in Ayurveda Online Research Summit is being done in India and USA. As the name suggests, as I said, it is online. It would be like you do not have to go anywhere. You can attend it from the comfort of your own home. It is a paid event, but not highly priced. And you can buy the tickets. It is just that September 7th is the last date for the early bird registration. You still have time. You can register and take advantage of the early bird. What this brings, we have the blessings of Ayush Health Secretary, Dr. Kotecha ji. We have the blessings of Bhushan Patwardhan ji, who is the Ayurveda Task Force COVID-19 in India. And we have eminent and distinguished speakers from all over India, Canada, and USA. Some of the speakers are like Balendu Prakash ji, Akash Kimpvi, Rajiv Vasudevan, Asit Panja, Rama Jasundar, Girish Tillu, Arvind Chopra, Sudeep Rath. The list is long. We have more than 25 eminent people from Ayurveda field. They are researchers. They are bringing direct case studies, their experiences. It could be a single case study or the large number of cohort. We had some preventative measures have been taken on the numbers as large as 300 people. They would be sharing their studies, what research strategies should be taken for Ayurveda, where we are lacking, and much more. So I would like you to go over and just check this COVID-19 lessons and emerging strategies in Ayurveda. And if you have any questions, I am open to session, and over to Dr. Pooja. Thank you, Dr. Pooja, for giving me the chance, and I hope my...
Thank you, Dr. Vandana, for a wonderful session. So before going for the questions, I have one query. Like you explained about the sessions, this online summit. Is there any interactive session also? Or?
Yes, we have. The summit is like we have this package that once the people register, we would email them their package, and all the recorded talks or recorded presentation of all the speakers would be with them, and they can join us for the live panel discussion. The time would be once they buy the ticket, they would get the link to join, and they can join and they can ask questions to the presenters directly. So we have interactive sessions in India and USA, and we have panel discussions. I hope this answers your question.
Yeah, thank you. And the first question is, any specific nutritional need for pregnant women during COVID-19? Any specific nutrition she needs to take care of?
See, COVID-19 itself does not create any specific need in the women. What they need to do is take care so that they are not exposed, like the guidelines, putting face mask and taking out preventative measures so that they are not getting exposed to COVID-19. It does not create any separate nutritional needs. During pregnancy itself creates some nutritional needs, like because of hemodilation, they need to increase their iron intake, which should not compromise the health of the mother and the health of the growing child. So those are the needs of the pregnancy itself that they need to take care of. COVID itself does not create any additional need.
Okay, thank you. Next query, one of the doctor is asking, if any pregnant women get affected with coronavirus, what will be the impact on her pregnancy or overall?
So, see, pregnancy is a long journey. I would start from, say, if she tests positive during early pregnancy. So we know that because of the COVID-19, if she tests positive, she could be symptomatic, she could be asymptomatic. So let's talk about the symptomatic patient. High fever. If she is having the symptom of high fever and during early pregnancy, when we know that organogenesis is happening, so high fever itself is a cause which can lead to either abortion. It may affect the baby negatively. Because that is the say or period of organogenesis, and high fever itself is uh, very a situation where it can affect the pregnancy adversely, whether because of COVID-19 or any other infection. So it may cause even abortion also. So this is the early pregnancy. Coming to the later stage, say during she gets infected during 6th or 7th month of pregnancy. At that time, there are no study to show that it is going to affect the baby adversely. We need to take care of mother. Definitely, we need to check whether there are other comorbidities like diabetes and hypertension and other heart diseases, any chronic kidney problem, any obstructive pulmonary diseases. If these are not, patient is not in high risk zone just because of pregnancy, she can be monitored safely. If she have these comorbidities, she needs immediate hospice care. It can affect patient adversely, it can affect the baby adversely. And then during the labor is a situation where the oxygen demand for the patient is increased, and COVID-19 is also a situation where oxygen demand for the patient is increased. So at that time, yes, patient is in compromised state and she needs immediate hospice care, and she should be managed as the situation is. So I hope this answers the question, because I have addressed all the 3 stages of pregnancy. Early pregnancy, if patient is positive, high fever. During the course of the pregnancy, say the mid trimester, if she have fever and comorbidities, she is in compromised state and it affects the babies. And during intrapartum, postpartum, I didn't say that. If she can breastfeed, yes. If patient has tested positive, there are 2 conditions: that she can be kept in the same room with the baby with the partition. She can be brought for breast, the baby can be brought to the mother for the breastfeeding, taking all precautions like mask and hand cleaning. And the other option is that breast milk can be pumped and fed to the baby. There are no research to show that like I said, vertical transmission, there is no research to show that it has transferred to the baby, but still it is a evolving situation and studies are coming. So at this point, we cannot say that it is transferred to the baby through the breast milk, or it is transferred to the baby through while the baby is inside the mother. During the delivery, if the baby is exposed, so when the baby should be tested immediately after baby, when the cleaning is done, no swab should be taken and tested if the baby is positive or not, and from there the management should be done. But the severity of the symptoms could be more if the patient tests positive.
Thank you, Dr. Vandana.
Sure.
Next, one of the doctor's query is, like we are prescribing vitamin D and iron tablets are the routine for every pregnant woman. During COVID-19, is it safe for them to continue all these medicines or any other specific?
See, iron and calcium is the requirement in India. What the FIGO guidelines are, we should continue with that. There are. It is not going to affect adversely. And consider vitamin D also, and many people are asking about vitamin C also, because many modern research studies show that vitamin C is immunity boosting. So prescribing these vitamins in itself is not harmful, where you choose the dose suitably and you prescribe looking up at the individual patient. It is not harmful. I think that I have answered the question. I mean, the answer. It answers the query.
Yeah. Thank you, Dr. Vandana. I think we should conclude the session now. All the queries has been taken. Thank you for joining us for today's session, and thanks to all the participants for joining us for today's session.
It
Thank you,
was a
ma'am.
pleasure to be here. Thank you so much for giving me the chance. And if there are queries later, also you can email me and text me. I would be very happy to answer. Thank you so much. Thank you everybody for joining me. I hope it was helpful. You yourself need to stay healthy. The doctors are at forefront, and many the news of the fatalities are coming. So if you take care of yourself, you would be there to take care of your patient. So your health, your safety comes first. Take care of yourself. When you see fit, only then you go out in the field. If you have any comorbidities, if you are suffering, I am very much concerned for your safety, for your health. Please do take care of yourself first. Thank you so much.
Thank
Okay,
you.
namaste.
Namaste.